Welcome to SmartSpot YouTube channel. Rabies. Rabies is a vaccine-preventable viral disease that affects the central nervous system of mammals, causing brain damage and death. It is usually transmitted through the bite or scratch of an infected animal, especially dogs. Rabies can be prevented by vaccinating dogs and avoiding contact with wild animals. If a person is exposed to a rabid animal, they should seek immediate medical attention and receive post-exposure prophylaxis, PEP, which consists of wound washing, rabies vaccine, and sometimes rabies immunoglobulin, or monoclonal antibodies. Rabies causes about 59,000 deaths worldwide per year, mainly in Asia and Africa, and 40% of them are children under 15 years of age. Rabies is also a major economic burden, costing about US $8.6 billion per year. Rabies is one of the neglected tropical diseases that can be eliminated by a One Health approach involving multiple sectors and communities. Evolution of rabies. The evolution of rabies is a complex and fascinating topic. Rabies is caused by lyssaviruses, a group of viruses that infect the nervous system of mammals. There are many types of lyssaviruses, but the most common one is rabies virus, Rabies, which has several variants that circulate in different animal hosts and regions. Scientists have used genetic analysis to trace the origin and spread of Rabies and to understand how it adapts to new hosts and environments. One of the main findings is that Rabies has two major types, bat rabies and dog rabies, which evolved in different ways. Bat rabies is the original type that emerged in Old World bats and then spread to other continents and animals, including dogs. Bat rabies has a high genetic diversity and can infect many species of bats and other mammals. Dog rabies is a derived type that evolved from bat rabies when it adapted to dogs, which became the main reservoir and transmitter of the virus to humans and other animals. Dog rabies has a lower genetic diversity and is more host-specific than bat rabies. Another finding is that Rabies has a history of cross-species transmission events, which led to the establishment of new variants and reservoirs. For example, in Europe, Rabies was introduced by dogs and then shifted to foxes, which became the dominant reservoir until control efforts eliminated the virus from most countries. In North America, Rabies was also introduced by dogs and then shifted to several wildlife species, such as raccoons, skunks, foxes, and bats, creating new epizootics and challenges for prevention. In South America, Rabies was transmitted from bats to dogs and then to humans, causing outbreaks in urban areas. The evolution of Rabies is influenced by many factors, such as the immune status of the host, the nature of exposure, the viral load, the environmental conditions, and the human interventions. Studying the evolution of Rabies can help us understand how it causes disease, how it spreads among animals and humans, how it can be prevented and controlled, and how it may emerge in new hosts and regions in the future. Rabies can affect many animals other than dogs and bats, such as raccoons, skunks, foxes, coyotes, cats, cattle, horses, and even humans. The symptoms and stages of rabies are similar in most animals, but some may show more aggression or paralysis than others. Rabies is usually fatal in animals once they develop signs of the disease. Some animals are more likely to carry rabies than others, depending on the region and the type of rabies virus. In the United States, bats are the leading cause of human rabies deaths, followed by raccoons, skunks, and foxes. In many countries, dogs are still the main source of human rabies deaths, especially in Asia and Africa. Rodents are very rarely infected with rabies and pose a low risk to humans. The best way to prevent rabies in animals is to vaccinate them regularly and avoid contact with wild or stray animals that may be infected. If an animal is bitten or scratched by a suspected rabid animal, it should be taken to a veterinarian as soon as possible for treatment. If a person is exposed to a rabid animal, they should wash the wound thoroughly with soap and water and seek medical attention immediately for post-exposure prophylaxis, PEP. Symptoms. The symptoms of rabies in animals may vary depending on the species, the type of rabies virus, and the stage of the disease. However, some common symptoms are fever, headache, lethargy, vomiting, and anorexia. Behavioral changes, such as aggression, anxiety, confusion, hallucinations, and abnormal behavior. Cranial nerve dysfunction, such as difficulty swallowing, excessive salivation, hydrophobia, fear of water, and paralysis of the face and throat muscles. Cerebral dysfunction, such as ataxia, loss of coordination, weakness, paralysis, seizures, and coma. These symptoms usually appear after an incubation period that can range from a few days to several months. Once the symptoms appear, the disease is almost always fatal. Therefore, it is important to seek veterinary care as soon as possible if an animal is bitten or scratched by a potentially rabid animal. Rabies can be prevented by vaccinating animals regularly and avoiding contact with wild or stray animals that may be infected. Incubation. The incubation period of rabies in animals is the time between the exposure to the virus and the appearance of symptoms. It may vary from a few days to several years, but is typically 1 to 3 months. The incubation period may depend on factors such as the location of the bite, the amount of virus, the type of virus, and the immune status of the animal. During the incubation period, the rabies virus travels from the wound to the brain through the nerves. The animal does not show any signs of illness during this time and is not infectious to others. However, late in the incubation period, the virus may reach the salivary glands and be excreted in the saliva before the onset of symptoms. This is more common in dogs, cats, and ferrets than in wildlife. Once the virus reaches the brain, it causes inflammation and damage to the nervous system. The animal then starts to show clinical signs of rabies, such as fever, aggression, paralysis, and hydrophobia. At this stage, the disease is almost always fatal. Therefore, it is important to prevent rabies by vaccinating animals and avoiding contact with potentially rabid animals. If an animal is exposed to a rabid animal, it should receive post-exposure prophylaxis, PEP, as soon as possible. What should I do if my pet has been exposed to a potentially rabid animal? If your pet has been exposed to a potentially rabid animal, you should do the following. Contact your veterinarian as soon as possible and follow their instructions. If your pet is up to date with rabies vaccination, it should receive a booster dose of rabies vaccine as soon as possible and be observed for 45 days. If your pet is overdue or has never been vaccinated for rabies, it may need to be euthanized or placed in strict isolation for 6 months, depending on the local regulations and the availability of documentation. If your pet develops any signs of illness, especially those related to the nervous system, it should be evaluated by a veterinarian and tested for rabies. Avoid contact with your pet's saliva and wounds, and use gloves and other protective equipment when handling your pet. Report the incident to the local health department and animal control authorities. Rabies is a serious and fatal disease that can be prevented by vaccinating your pet regularly and avoiding contact with wild or stray animals that may be infected. If you have any questions or concerns about rabies, please consult your veterinarian or the local health department. Thank you for watching the video. Please do subscribe for more videos.